Thank you so much, everyone. I am the program manager for the True North Prostate Cancer Survivorship Programs in North America at Movember. And I wanted to take an opportunity to provide you with a really quick high-level overview of Movember, given that prostate cancer is a very prominent cause area for us, and as well as True North, which is a Movember initiative. But just before I do that, I wanted to start off by showing you a Movember film, which in 5 minutes or so highlights the story of a Detroit man who is a football coach, preacher, father, husband, Alonzo McCann. And he's essentially dedicated his whole life to helping others. And the story depicted in this video takes place 9 years after Alonzo's prostate cancer diagnosis. And at the time, Alonzo was still on his journey to recovery. And the video is really his own account of his path and his own trials and finding the help that's needed. So with that, I will show you the video.
Growing up in urban America, being an African-American man, your sexuality is as big as anything. To be stripped of that, anybody who told me to do this and now I'm here, man. As a coach, the life experiences I give my players are things that I went through. From my mistakes in football, hopefully it'll work for you. From my dark place, hopefully it'll shed light for you. 1, 2, 3, That's it. We all we got. We all we got. We all we need. We all we need. When it's tough and it's 95 degrees and you sweating and you tired, there are going to be periods in your life where you're going to be ready to give up. And it's a microcosm of football. There are going to be times in a football game where you're going to want to quit. August 2008, the doctor's office called me and says, come on into the office. The doctor has your results. You have prostate cancer. And that's where the journey started. I completely shut my wife out of the process. Completely. At that point in time, the research that I was doing was really looking at the sexual side effects, erectile dysfunction, and things of that nature. I mean, my wife is, younger than me. And so February 4th, 2009, I had surgery. During recovery, the incontinence was so bad, I can't even hold it to go to the bathroom. Hell, I don't even know when I got to use the bathroom. I didn't talk to anybody. It was a dark place. 2009 was a living hell. And, it got to a point where I kind of shut the world out. When you took pride in what you would call being a man, and everything that you thought made you a man had been stripped away from you in one day. I was a man on February the 3rd, and I was the shell or the image of a man on February the 4th. Set. Hit. Drive, stop. You gotta shoot your arms through. Grab. Shoot your arms through. Coaching is paying attention to these things. When you get here, and the little things matter. Shoot your arms through. All right? Drive through. If I'd have asked a small question. Hit. Drive. So tell me about, what does incontinence mean? What is that? I saw it on the sheet, but that didn't cross my mind. I was thinking about erectile dysfunction. Being exposed to research and being exposed to stories and people is really what saved my life. Good job. Good job. Let me suggest to you that you take this path right here. Let me suggest that you include your wife. Let me suggest to you that you ask the doctor the questions. And if you don't have it in you to ask him the questions, then you need someone else to go or write them down. You have to open up and you have to talk to people. I tried to do it myself. And trying to do it myself, you would have never heard my story because I wouldn't be here. But success, when somebody says to you, I would not have made it if it had not been for you, that's success. And when you live your life for something that's bigger than you, you'll always be a success. You'll always have enough fight to overcome any trial or any tribulation. In the course of a game, you all you got. But guess what? You all you need. But I mean that. And so it's learning to think differently. And that's it. That's a journey that's going to be lifelong. But I get better every day. I get better every day. Hey, Sister Pride on me, Sister Pride on 3. 1, 2, 3. Sister Pride.
So thank you so much for engaging me with watching that video. But I've seen this video 15 times already, and every time I watch it, I'm always still moved and impacted. And men like Alonzo are exactly why we do what we do. It's exactly why I do what I do, which is trying to help men transform how they think about health as well as how they act on it. So I'm just going to share my screen again. So Movember is a leading global organization which is committed to changing the face of men's health. And we have a total of, we have one goal, and that is to stop men from dying young. And we don't want them to just live longer, but we want them to be happier and we want them to be healthier. So it's really about quality of life, which some of the previous presenters have already touched on. And over the course of many years, we have funded over 1,200 innovative men's health projects globally, of which 300 are in Canada alone. So when people think of Movember, they tend to think of the campaign, the movement that takes place every November for the entire month, where men grow mustaches and they raise money and they raise awareness. And so what awareness are we trying to achieve? As most of you already know, and has already been mentioned by, again, the previous presenters, men take more of that out of sight, out of mind approach to their physical and mental health. And in fact, studies have indicated that men are less likely to see a health professional than women. As a result, they tend to suffer in silence. So we're aware that we can't change behavior overnight. And we're also aware of the ethnic, cultural, and socioeconomic factors, for example, that impact individual behavior. And with that, we focus on 3 important men's health issues: mental health and suicide prevention, testicular cancer, and prostate cancer, which of course is the focus here today. So using the funds that are raised by our Mo Bros and Mo Sisters, who we like to call our community of fundraisers, we get to collaborate with some of the world's most brilliant and world-class researchers to develop effective treatments, innovative support solutions, and resources for men that can be easily accessible. So we all know, when you're diagnosed with a particular health issue, or if a family member is, our initial reaction is to go online and start researching and looking up information. And so we want to make sure that the resources that we provide are vetted through healthcare professionals and are reliable sources of information. And so with respect to prostate cancer, our goal as an organization is to contribute to having the number of men dying from prostate cancer, having the number of men experiencing mental and physical side effects from prostate cancer treatment, and improving the quality of life of those with prostate cancer by 2030. So not a small task at all. And so these are some of the areas Movember funds within the prostate cancer space. So health promotion, biomedical research, clinical quality, and survivorship. And it's important to note that Movember is the largest national non-governmental funder in prostate cancer. And so thus far, there's already been 564 million Canadian invested globally in this area. So I wanted to highlight a global study where Movember-funded researchers are trying to find out why Black men have a higher risk of prostate cancer than other ethnic groups. And so the researchers looking at genes of healthy men at higher risk of prostate cancer, so that includes men of African and Caribbean descent over a period of 5 years. So this is just one of the many globally funded initiatives, and this one's actually based out of the UK. So why True North? What is it? So True North is a revolutionary new care and intervention program that will help men living with prostate cancer to get access to quality of life, quality enhancing tools, information, and resources that will give men control over their decisions and support throughout their experience. And that's from diagnosis to treatment and beyond. So every man's experience in living with prostate cancer, as we know, is different from treatment side effects, and the severity varies significantly. And we know that men have unmet needs, particularly with regards to decision regret, psychological, and sexual issues. So True North provides that personalized, practical information support programs that individuals can access, as well as their families. And also we focus on research innovation in these three key areas. So self-management tools, supported care models and clinical services, and as well as training for healthcare professionals. And so here are some of the countries where we have funded programs. So we're hoping to scale some of these programs more globally, particularly in areas where there's unmet need. And one example, as Dr. Matthew had mentioned, is looking at scaling the sexual rehabilitation e-clinic globally. These are just a highlight of some of the True North prostate cancer programs. So one that I want to highlight in particular is the peer navigation program. So which falls under our survivorship portfolio. So once diagnosed, as you know, many men continue to feel lost and confused, particularly when they're navigating a fragmented system. And often they feel overwhelmed with just the sheer amount of information they receive. So peer navigation, the program trains peer navigators who then assist and guide and accompany men with prostate cancer, as well as their partners, caregivers, and families, and really guiding them through the social and community health systems. And that's from the point of cancer diagnosis and beyond, in order to ensure that the their practical and emotional supports are met. So unfortunately, Dr. Jackie Bender, who co-leads this initiative, couldn't be here today. But I do know that one of her goals for the program is to increase the number of men of color, and in particular, Black men who are enrolled in this program that could benefit from peer-to-peer support. As we all know, oftentimes men are more willing to get support from someone they can identify with, and also who's been through what they've been through. So we also have the sexual health and rehabilitation e-clinic, the SHARE clinic, which Dr. Andrew Matthew has already spoken about in his earlier presentation, and whom you've already been introduced to. So Dr. Matthew, on top of everything else he does, leads the SHARE clinic program, and he's really a significant contributor and collaborator across various Movember and True North programs and initiatives. And he's also going to be the next presenter again. But before I hand it back to Dr. Matthew, I just wanted to thank you for your time. And if you do have questions, I don't think there's time for Q&A now, but if you do have questions or want to find out more about anything that I've discussed here today, or didn't get an opportunity to discuss, please do not hesitate to contact me. My information is there. And with that, I would like to pass it back to Dr. Matthew.
Thank you, Tika. Before we get Dr. Matthew on, I just want to express my appreciation to Movember for being a big part of what we do today and to help with men